welcome everybody to this video. Thank you so much for watching. Today we're going to be talking a little bit about the political process, especially the legislative process. Politics plays a huge role, as you know, and it's gotten even more political over the last several years. But as we're looking at how federal healthcare laws have impacted how we're receiving care, it's important to understand the context of how the Affordable Care Act evolved through the legislative process. And then it will help you understand how some of these changes are happening as we go forward. The law had a 10-year implementation period, and it took nearly 2 years for them to get it passed. Take you back to the future, back to a time when I had hair. I always was a political junkie, but that is me. Behind Senator Grassley and Senator Hatch, used to work for the Senate Finance Committee, the committee in the United States Senate that has jurisdiction over federal tax policy, Medicare, Medicaid, Social Security, trade policy. There really is a lot going on at that committee, and I was very blessed to have the opportunity to work there. Right out of college, I was just a young pup thrown in with the Wolves of Washington, but they were able to get a lot of good things done at the time. It was much more bipartisan when I worked there. And Senator Grassley and Senator Hatch were the two lead negotiators for the Republican side as the Affordable Care Act went through the process. I'm a millennial, an older millennial, and some of you may remember Schoolhouse Rock. It was a public service announcement cartoon that was put out when we were kids. And it's really neat to watch. You can easily find it out on YouTube. But the video really does an excellent job of explaining how how a bill becomes a law, because there really is a process. Our founders were very thoughtful in how they structured this. They wanted to have a system of checks and balances, meaning that no one of the three branches of our federal government would have more power than the other. And so that, therefore, the way they structured the United States House and the United States Senate made it so. And as we look deeply into how the law passed, we're going to find that it did not go through regular order. And this has a lot to do with how much regulatory authority has been given to the Department of Health and Human Services, the Center for Medicare and Medicaid Services, which falls under them. They're the agency in charge of implementing a lot of things, such as the health insurance exchanges, for example. But I'm not sure if you are a basketball fan, but I certainly am, both NBA and college. And one of my favorite times of the year is when we fill out our brackets. And if you were to compare the Affordable Care Act to a basketball team, it would be the ultimate Cinderella story in how it got through. And so I'm going to just reflect a little bit on how it became a law. I'll provide a little bit of commentary, and you'll understand after I'm done why it's so important to understand how the law went through the process. If you watch Schoolhouse Rock, that video, you can, and we'll put a link to that in our show description. But if you watch that, you'll notice that the committees are incredibly important in how public policies are made. So if you're a member of Congress, the committee assignment that you have makes a huge difference, particularly if you're in the House, because that's going to matter what issues you really spend most of your time working on. And the idea is that's where the legislation should be crafted, because everybody from both sides are able to really roll up their sleeves and get things done. So as the ACA evolved through the process, it went through the House of Representatives first initially, and they put out, this was probably in the summer of 2008 is when all of this, 2008 or 2009, 2009 actually, is when this was all going down. These HR 3200s, you may recall, they called them the town hell meetings because the people that were opposed to this were very, very upset, shouted down certain members and senators. But H.R. 3200 made it through the House because the Democrat Party had a huge majority at the time. It made it through on a very, very narrow margin because some Democrats, they were referred to as the Blue Dog Democrats, did not vote for the ACA. There's all kinds of stories, rumors. I don't know what to believe, but there are a lot of stories about how hard it was for them to get it through. Apparently, Rahm Emanuel, who was President Obama's chief of staff, might have confronted some people in a gym, for example, in the House gym to get them to vote for it. And as you can see, it passed by only 5 votes. It got through, and then that bill was dead on arrival in the United States Senate. Some people who work in the House refers to the United States Senate as a place where all good things go to die. The Senate is a much more deliberate body, and things move much more slowly through there. The House is much more regimented because there are 435 members, whereas the United States Senate has 100 members. And so this H.R. 3200 passed, and then they passed something close to it, barely, on Christmas Eve, H.R. 3590. You may recall it was on Christmas Eve day they were able to get it through. They thought that they had finally passed health reform for the first time in a long time. But then something happened. Senator Ted Kennedy passed away, and there had to be a special election in Massachusetts to replace him. And Scott Brown pulled one of the upsets of the century, and actually a Republican won that race, and he was against the Affordable Care Act. That was one of the actual reasons that he won the race. And around this time, the intensity of dislike for this particular piece of legislation was really growing. It ultimately culminated with the formation of the Tea Party and the 2010 midterm elections. Well, right now we're back in 2009. So Ted Kennedy passed. They had a very, very narrow margin. They passed it barely, 60-40, because they had to have enough votes to overcome the filibuster. Nobody knew what they were going to do. They have a White House summit. They finally come up with the idea that we're going to divide the two controversial, or take some of the controversial pieces of the bill and put it into what they call a sidecar piece of legislation. So the Affordable Care Act is actually 2 different bills. It's the Patient Protection and Affordable Care Act, which is the meat of it, the majority of it. But then there's like a thin piece of legislation, which is called the Healthcare Reconciliation and Reform Act, the Reconciliation Bill, H.R. 4872, if you want to look it up. And it did not have to get the 60 votes, so it got through. So my point in explaining all of this and how it all evolved is that this law is probably the furthest piece of legislation from that video, I'm Not a Bill. So if you will go back and watch that video and see how they say it's supposed to go through the process, the way that it was passed was very, very controversial. It did not go through regular order. And as a result, because it originated in the United States Senate, the final piece of legislation, it was much more conceptual, and it delegated a lot of authority to the executive branch to implement it. And this is what really important, because most of the laws are supposed to originate in the House of Representatives, especially if they involve tax policy, which this law at its origination had 19 taxes in it. The Senate, like I said, is much more conceptual. So they were the ones that were taking the lead on it, and it went straight to the floor. It did not go through the committee process. And as a result, they had to be very vague in their legislative language because it was so controversial, just in order for them to get enough votes to pass. And as a result, over 1,500 times, they gave the executive branch authority to implement this law. And this is one interpretation of what the Affordable Care Act looks like in flowchart form. But I ask you, which which member of the cabinet has the most influence or the most power? And, some people might say, well, Secretary of Defense or Secretary of State. I would make the argument that the Secretary of Health and Human Services has a huge responsibility, especially from the department, from a budgetary standpoint. I'm going to show you that slide next. The Department of Health and Human Services is the agency or the cabinet department overseeing the implementation of the Affordable Care Act and other healthcare laws. But because the law was so vague and they had to rush to get it through, and it didn't go through the committee process. See, if they would have just passed it more incrementally and gone through the insurance market reforms and a couple other things, I think markets would have been a lot more stable. They're finally starting to stabilize now, but it was a rough 10 years for a lot of people. A lot of people were hurt. If they would have just been a little more incremental, it wouldn't have been as problematic, because here's an example. This is the Class Act. It's Title IX of the ACA. The actuaries of the Center for Medicare and Medicaid Services, this agency that is under the Secretary of HHS, said, we can't implement this. This just doesn't work from an actuarial standpoint. So they had to just essentially just repeal this whole title, this whole section. It was for long-term care. So you've got things that are controversial. We've got all these things that are impacting physicians. So this is having an indirect impact. A lot of them are tracked through electronic medical records. We're going to be doing a program on that. Our latest column on our website actually discusses technology and healthcare. This is also the only piece of legislation that's really had such a big impact with all three branches of the federal government, because even the judicial branch has had to get involved over multiple things. But it actually began on election night when attorney generals from multiple Republican states filed a lawsuit over the individual mandate. A lot of it centers around this issue of the delegation of authority to the federal bureaucracy. They just were not specific enough in their language, and it's just left a lot to be interpreted by the courts. Hosted a radio program called America's Healthcare Challenge since 2012. Our first episode actually was like the week before the Supreme Court upheld the ACA. And I remember back at that time, a lot of people thought that it was going to get repealed. And at that time, I was just getting started, and I'm like, oh man, I don't think they're going to get rid of it. And I'm like, do I actually go on the radio and say that? And because what if I'm wrong? But I was right. They didn't uphold it, and they had us. I just remember that was a huge day in the news. And the reason it went to the Supreme Court, and the reason why people get so fired up about all of this, is because we're trying to debate, or we are debating this issue. And I would even argue that this goes into politics now of what is the role of government in our lives and in public policy, specifically healthcare. Is this too much government involvement, and can we afford it? Those are the two things that at the end of the day everybody was upset about with regards to the Affordable Care Act. The reason we're posing the question, is this too much government involvement, is because half of healthcare spending already comes from U.S. government resources. After the ACA was passed, the federal government, and so this is kind of a state versus federal government issue for some people, the federal government gained a greater role in regulating private insurance. About 15 million people were added to Medicaid. That's right around what their estimates were. 15 million were supposed to be added to the ACA market. The individual mandate has gone away. They had a issue with the rollout of healthcare.gov. We're looking at about 8.5 million that have actually enrolled between Medicare, Medicaid, and ACA, the ACA market, or what people are calling Obamacare market. It was supposed to cover 32 million. That was their initial estimate. So they got that through a Medicaid expansion, but they did not get that through the ACA marketplace. And we showed a chart in our last video check it out. It was on, it's a lesson on health insurance, and we go through some of the reasons why that might be the case, why they underperformed. And a lot of people still want, the majority, 160 million, continuing to get it through their.
I can't take this anymore. My company just got a letter from the IRS about Obamacare, and I don't know what it means. It's so confusing with compliance, changes in health insurance, managing employees. It's just too much.
Call Sean McGuire at Bellis.
Who?
Sean McGuire. He created a company called Bellis to help people just like you.
But it sounds expensive.
It's a fraction of the penalties you might pay. The people at Bellis are always trying to find ways to save money and have services for companies of any size.
Call Sean McGuire at Bellis at 402-884-9020. He'll find a way for your company to save thousands on healthcare and prescription drugs, as well as compliance costs. Your first consultation is free. Call Sean McGuire at Bellis, 402-884-9020. 402-884-9020. At Bellis, they'll help you solve the problem.
So the CBO, like I was saying, they were right in their expectation for Medicaid, but they were wrong in their expectation of ACA coverage or through the exchanges. A lot of these taxes, and this is what I'm concerned about with their long-range projections of this law, is that the taxes that were in the law to essentially pay for the law are either they call it kick in the can. They didn't kick in right away. So the law was passed in 2010. Some of the taxes kicked in 2014. Some were supposed to kick in 2018, and they keep delaying them. And so, as we call it in the policy word, cost containment is on the back end, and Congress doesn't like to vote to uphold taxes. And so there's just difficulty in determining if we're going to be able to afford this program and Medicare for all, for that matter, which is a big campaign discussion. This is how your taxes were spent in 2009 before the ACA was passed. And remember how I was saying the HHS secretary has a lot of power from dollars and cents. Look how much of your federal tax dollars go into that agency. There's Social Security over there. Department of Treasury. This is a big one. Interest on public debt. This has actually gone up. The higher our debt goes, the more we have to pay interest. So if you look at it, and then of course Department of Defense. But HHS, this is again before they put it in place, but the ACA is going to go into here and make this pie bigger. So if this gets bigger, what needs to happen? You need to cut spending or raise taxes. I always wanted to pay for something with a suitcase full of cash. I always thought that's cool when they do that in the movies, even though they're probably not doing very good things with that, but it just kind of looks cool, you know. But this is what $1 trillion looks like, which is what our deficit is. It's actually a little bit over this, a lot over this. And that's $1 million. What $1 million looks like in a human next to a dude. But that's what $1 trillion looks like in double stacked pallets. And that's how much your federal government loses every year. And then there's also indirect costs, which would be new federal government employees. And then we've got the challenges facing the medical industry. And we're going to actually talk about that issue of how the medical industry has been impacted by these changes in federal laws in our next video. I appreciate you taking the time to watch it. In summary, the Affordable Care Act is one of the largest, if not the largest, pieces of federal legislation that will pass in a lot of our lifetimes. It did not go through regular order, and it has totally disrupted the industry. I hope you understand a little bit more about how it went through the process and why things are going to be difficult. So if you would like to learn more, if you'd like to sign up for my course for some more advanced training on this issue and other things around federal health policy, click the link in the show description, and please make sure to subscribe to our page and follow us on all of the socials. So we're on Facebook, Instagram, and our YouTube. It's all at America's Canary, because that is Edie Bellis. We're trying to be America's canary in the coal mine in all of these changes in the federal government. Thank you so much for watching. We'll see you next time. Hey, this is Sean McGuire here. If you enjoyed that, make sure to listen to our podcast on iTunes and SoundCloud. Just look for the Canary, that's America's Canary in the Coal Mine, on iTunes and SoundCloud, or type in America's Healthcare Challenge.